My name is Michelle Sale. I'm a clinical psychologist working in the Persistent Pain Team in Southampton and with the Solent NHS Trust. So today's session is aimed at looking at the impact of living with persistent pain and to explain a bit more about how we support people living with persistent pain in our service. So it complements one of the sessions that you'll likely have as you come into their service, which is our introductory session, where we cover this. And this recording is so that you can go back and look over the ideas and themes in your own time so that you can rewind and look at it at your own pace. It also goes alongside another recording on our website which explains similar from the introduction session about the physiology of pain. So taking those two to work together as well. So we hope that today is helpful just to explain really about how we support people to manage the impact of persistent pain and looking more at the impact of that. So just a reminder to take breaks as you need to whilst you're with us and watching this recording. Make yourself as comfortable as possible and do move and change position as needed to as well. So we know that living with persistent pain gets in the way of doing things that are important to you. And that's our focus really as a service, is thinking about how can we support with the impact that managing persistent pain day to day can have. So I'd like to invite you to have a think about, if you were to come through our service and for it to be helpful, what would need to happen or what would be different? So what would you be doing differently, or what might you be doing more of or less of if it were to be helpful? So answering this question almost of, I'll know my life has got better when. Okay. So Richard, if you're happy to share, do unmute yourself.
Yeah, I mean, I was always very, very active, but now I'm at the point now where I can't really do anything, can't function properly. So just to be more active again and be able to get out and about. I mean, at the moment, everything's just on hold.
Finding a way to get back to some of those activities, or to just increase your activity and exercise as well.
That's right, yeah.
That's great, thank you. Nick, did you have some ideas you were happy to share as well?
Yes, I feel I'll be getting better once I've stopped being grumpy, which my family tell me I'm now. I used to be sort of quite a happy person, and now I'm not. I'm just very grumpy all the time. So I'm looking to get back so that I can do more with the family, really.
What type of things would be meaningful for you with the family? How would you want that to look?
Just that I was always happy. I've always been known as a happy person, and I'm not anymore. I'm just very grumpy, and I think that would be a way of seeing that I am coming out of what I'm doing. I know what I've been told by a consultant neurologist, that I need to swim. He didn't tell me why, but I need to swim. He said, and work up to 5 times a week, which I'm trying to do, but I don't understand why I'm trying to do it.
Okay, that's really important. I think lots of the ideas you've mentioned there are some similar to what Richard was saying about kind of finding ways to get more active, but I'm also hearing a sense of making sense of the recommendations that are coming from different health professionals as well, of understanding not just what you need to do, but why, and understanding your condition as a whole rather than kind of little bits of things, and also finding a way to feel happier generally and manage the impact that it can have on relationships with family and things day to day. That's really helpful, thank you. Okay, so just checking if there's anyone else that's happy to share. Okay, Kevin, thank you.
I'd like to get back into drama. Amateur dramatics has been a really important part of my life, and recently I've had to withdraw from a couple of plays, which has been really upsetting for me. I know that I might not be able to do it to the same level that I was. I know that I might have to look at different ways of still being involved in that, but that's how I think I'll know when I can get back to drama.
Yeah, so finding ways to kind of connect with things that are really important to you, even those kind of real passions and hobbies that really make a difference, finding ways to do that whilst managing the pain.
And it's something I share with my daughter as well. So she's quite involved, and to be able to be there with her doing the same thing is really important.
Okay, so yeah, a connection again similar to Nick with kind of family and the impact that pain can have on relationships, and wanting a way to keep that connection up. That sounds good. Is there anything else that anyone would like to share before we move on? Anything that you'd be doing less of or more of? Richard?
I'd like to better understand why before I used to work my way through it. If I had pain, if it was just in my back, I was okay and I could walk it off. I would just keep going, and that worked. And now it doesn't work, and I don't understand why.
Okay. So almost working out what's not working and understanding why that is in order to then move forward, and related to some of those things that you've already said that were kind of important to you with family, if you can find ways, things that work and are helpful. Okay, and Richard, do you have something to share?
Yeah, I mean, at the moment, I just seem to spend all of my time just not knowing where I am with the medication that I'm taking. The medication seems to just take over a lot of what I want to do. I don't feel that that's right for me, but I don't have any other alternatives. So if I can just even reduce some of the opiates that I'm taking and reduce some of the side effects that I'm having from that, and then that's got to be an improvement.
Yeah, finding a way other ways to manage, as well as the kind of medication, and ways to reduce that because of the impact.
Yeah, I mean, there's got to be a lot more than just continually taking, more and more opiates and bigger and bigger quantities of opiates that don't, at the moment, just don't seem to be doing anything for me.
Definitely. And I think today is part of the process of talking a bit more about kind of those other options and what else is available really in our service, thinking about the way that we support people to manage persistent pain, not just with medication, with a various array of many other different approaches. So that's really great that you've brought that up. Okay, is there anything else before I move on? Or is that I feel accurate? Okay, lovely. So thank you for sharing all of those. I think they're often things that we hear from people when they come into our service for their hopes really of what they'd like to be different or better from if our service was to be helpful. So some of the things similar to that you've mentioned really are, feeling happier, improving your mood, feeling just more yourself. Some people have goals kind of wanting to get back to employment in some way, or a kind of a role that's kind of rewarding. It might be volunteering as well, something that gives that sense of structure and meaning and purpose to each day as well. Like you shared as well, so improving relationships with family, finding ways to spend more time together, or for that time to feel more of a quality time, that you're able to really enjoy that time together in the way that you might used to. Again, similar to that you've mentioned about getting back to exercise in some way, finding a way to feel safe to move and build up in a gradual way. Also, understanding yourself more in terms of managing and adjusting to living with persistent pain. That sense of identity and feeling kinder to yourself is sometimes what people suggest. Socialising more, spending time with family and friends as well, or it might be as well kind of getting back to hobbies and passions, like you mentioned, Kevin, as well, finding ways to do that. So what we know, and as you've talked about as well, is that often pain really gets in the way of doing those things, or doing them in the way that we would have done them before. So just thinking about kind of how we manage that, or how you've managed that. So next, I'll just invite a second question of, what have you already tried before coming to our service to try and stop pain getting in the way of you doing all of those things that matter to you? So often people have tried lots of different things before they even get to seeing us. So what have you already tried? Okay, Kevin, thanks.
Distraction for me was always a really big thing. If I went out and did anything, it'd always be with headphones in and an audiobook playing, just to try and focus my attention away from the pain that was going on. Even at work, when I was working, when I could work, I would have one earphone in so that, you know, my attention wasn't constantly on the pain, because it was overwhelming at times.
So kind of keep the mind busy, trying to distract yourself when particularly at bad times with the pain, or just generally distracting.
I found often it would be all the time that I'd need it, but yeah, there were specific periods during the day when it would be, I'd have to go somewhere quiet and listen to something, just to almost to center myself again. And breathing was, you know, getting very fast and very erratic, while almost panicking with the pain levels that were coming up.
Okay. So trying to distract not just from the pain, but also the kind of anxiety and that feeling of kind of panic when that was coming up for you as well.
Yeah, exactly.
Thank you. Has anyone else experienced different ways that they've tried to manage so far? Richard?
Yeah, I mean, I'm persistently chasing doctors looking for fixes, and you know, I've tried all sorts of different things. I've tried, acupuncture, and you know, chasing the doctor for different procedures and things like that. And it doesn't really seem to matter what I do. It doesn't seem to make that much of a difference. But I'm one for trying to read and understand what's actually going on with me. But, you know, sitting reading the internet all the time, it doesn't really get me anywhere. But I keep thinking that if I understand what's going on in my body and somebody can tell me what's going on, then I'll be able to manage it better. But you know, it's trying to gain more knowledge, thinking that if I know more about it, then surely I'll be able to fix it in some way. And I always seem to be trying to look for that fix.
I think it sounds like there's a few things. There's almost kind of trying to find a way to understand it, and researching off your own back, and trying to get a sense of what the pain is about, but also going to kind of the doctors or professionals, trying to kind of ask their advice, and feeling like there's lots of, you're still not getting anywhere with that.
Yeah. I mean, when things get really bad, you know, I tend to try to switch off to everything, and you know, just try to not quite isolate myself, but just try to stay as calm as I can, try to relax as much as I can, which is extremely difficult. You know, try to move as little as I can, thinking that, you know, well, with me, the more I move, the more it hurts. So if it's hurting, you know, when it gets really bad, I just want to lie down and do nothing, switch the lights off, and kind of hide away a little bit, really.
Yeah, and I think that all of these reactions are so understandable when you're trying to find a way to manage. It sounds really good that you've noticed that that's a pattern that you find. You're trying to kind of just withdraw and you know, cut the inputs a little bit to manage in those moments, but also recognizing some of those things some of those patterns aren't helpful in the long term, that you've noticed as well. Okay. Nick, did you have your hand up as well?
Yes, it's like Richard. I feel it's my pain. I want to take control of it. Before, I said for 49 years, I'd taken control. I'd learned exactly what my back needed and my legs needed to work it. Either I went to the physio and got the pain back into my back, or I just worked through it. And I can't understand why that's not working. And I've been back to the specialist. I've had MRIs, I've had nerve conduction tests, and then this neurologist that said that it's functional pain and in my brain. And I understand now that the brain, and that was very helpful, that the brain is what sends out the pain signals and always has done, and that my brain is trying to protect me, but I can't understand why I can't work through it like I used to, and what I need to do.
Okay.
And why he told me to go swimming. I would try anything. If you tell me to go and stand on my head in the car park, I'll do it. But I'll be more inclined to do it if I know why it will help me. And that's what I don't understand at the moment.
So it sounds like you've done a fair bit of work and understanding about what the pain is about, but there's some strategies that used to be helpful but are not helpful at the moment. And there's a sense of trying to keep doing the things that worked, but not knowing why they're not working now.
Yes.
Wow.
In fact, they have the opposite effect now. They just make me worse.
Okay, that's good to notice that. Thank you. And Kevin, did you have something as well?
Yeah, I found myself in accident and emergency on numerous occasions. When the pain got too much, I had various scans. I was in for a week, 2 weeks at a time. Eventually I had a surgery, which provided some relief, but only for a limited time. And then I was back to where I was before I had the surgery. So it's constant looking, as the other guys have said. It's that search. You always want to know, you want to understand. And, you know, to be told that it's something that maybe the original reason for it's gone, but it's still there, is quite a difficult thing to comprehend.
Definitely. I think that's a really important point, is in the process of going through these processes and trying to understand what's going on and looking for these fixes, is that it also brings up lots of difficult thoughts and feelings as well, in trying to manage and make sense of it, which is really understandable. We want to work out what's happening in order to hopefully move forward. But
it is that rationalization that I think takes so much effort. And, you know, it's something that everybody needs an answer, and there isn't always a simple answer. And it's hard not to want to find it. So you keep looking and looking and looking, and whether it does any good or not, I don't know.
Yeah, so recognizing that pattern of trying to connect, that we were saying, that struggle of trying to connect to the things, and in order to do that, trying to find an answer or a fix, but almost that taking a lot of energy in itself, and not being sure where that leads. Yeah. Richard, did you have a last point that you wanted to make as well?
Yeah, I mean, the other thing that I've got a tendency to do is rely probably too heavily on medication. And, you know, some of the time I've probably taken more than what the doctors have said is advisable to take, you know, more than the prescribed dose, you know, on the basis that if you take more, it's going to help you more. But really, I've struggled with that. You know, all it does is makes me less functional rather than fix the pain problems. You know, it's just kind of look for a fix type thing. And, you know, some of the time I've looked for it through, you know, the medication that I've been taking. And some of the time you take too much and it still doesn't make any difference to the pain.
And I think it's important to remember as well that taking more medication than prescribed may, as well as it may be not helping the pain, it may also be harmful to you. So we would never recommend doing that.
Mm-hmm. Yeah, I think, yeah, thank you for your honesty with that, because it's often a pattern of trying to find a fix and trying to find a way to manage. But obviously with the medications, there can be then other knock-on effects and consequences to those, like you're noticing, and it's a really understandable pattern. But noticing that that's not moving things forward in the way that you would like, or it's not as helpful. And obviously today, as part of us thinking about a slightly different approach, which we can talk about as well. So yeah, thank you all. I just want to double check if there's any last comments or ideas. I can see Kevin, is your hand up as well?
It was, but I've forgotten what I was going to say. I think it was something along the lines of what Richard just said. I think that really, it rings a bell a lot with not always being able to follow the advice because you don't feel the advice goes far enough. You know, as if somebody doesn't understand what you're feeling, and then maybe trying to, you know, if I took a little bit more, would it help a bit more? That really, yeah, resonates.
Definitely, it seems to be a bit of a theme as well with what you were saying, Nick, about you know, there's various advices maybe from different professionals or different websites or places that you look, and sometimes what's most important first is the understanding of why is this recommended, what is going to be helpful, and what are the boundaries and kind of counter indications as well to those things. But I think also, like you said, is sometimes recognizing that quest for more information and more understanding can often sometimes take away from the things that are important, that are the things that you're kind of wanting to be doing, with the pain still there. So thank you everyone for all of those ideas. I think they're really similar to other things that people have said as they've started through our service as well. So some of the ideas I think you've touched on as well is often people, when trying to get to the things that are really important to them and living with the pain, is just to kind of almost try and ignore the pain, trying to push through just to get to do the thing that they really want to do. Or like you were saying, Kevin, about kind of distraction, just trying to kind of keep the mind busy in order to keep doing the things that we want to do. Some people talk about kind of withdrawing, that you mentioned as well, just to try and kind of have less input. But as a consequence, sometimes that means that the things that you're trying to get to that are really important actually then feel further away. Similarly, other people talk about kind of taking more and more medications and not being sure if those are kind of helping, or not feeling that they're actually helping with the pain longer term, but just trying to find a way to manage day to day. Other people might talk about kind of just trying to avoid moving because of a worry that it will cause more pain, just kind of stopping doing the things that you want to do. Or seeing, as you mentioned before, seeing health professionals lots of times feeling like you're kind of going in circles, or even paying money for different treatments kind of privately, and feeling like still they're not helping moving things forward. And also some people talk about kind of managing with drugs or alcohol, or just trying to kind of force themselves to think positively to keep getting to the things that are important. I think what we've talked about and what you've already seemed to kind of be thinking is that sometimes there are things that you'll be doing that really help, both short-term and long-term, to manage the impact of pain. But sometimes there are things that actually, in trying to manage the pain, actually can sometimes not make life feel better. And actually sometimes, even in the short term, if they might be helpful, in the longer term, they can actually sometimes increase that sense of pain and create these cycles. So often with noticing these patterns, is people can come to us feeling like there's a sense of stuckness, sense of going around in circles and feeling like things just aren't moving forward. Talking to lots of different professionals, they're giving different suggestions or advice, and there's not really a clear way forward. And sometimes people talk about our service a bit like coming to the end of the road. It's almost they've tried all these other things and it's not, they're not getting anywhere, and then they end up with our service. And we often kind of think about our service as, instead of the end of the road, but as a bit of a kind of change of direction, a break from noticing these patterns and choosing a different kind of approach. So just to explain a little bit more really about how we support people in our service and the type of approach we take, that different approach. So obviously there are many things that we can come up against in our lives that we can't get rid of or can't control in some way. And the bit that we do have a choice around, or the bit that we do have control over, is kind of how we react to that situation or how we respond to that situation. And so sometimes we can do things that take us kind of away from the things that really matter to us, away from the type of person that we want to be when we come up against that type of situation that we can't control. And we'd call them away moves, because obviously they're the things that take us away from the type of person we want to be, or the things that matter. And sometimes we can respond in a way that connects us back to the things that matter to us, or improves things kind of longer term. And we'd call those towards moves, because obviously they take us towards the things that really matter and the things we value. And what we invite you to do in our service is to take a step back and to notice what moves you're making in response to pain, and noticing that what moves are away moves, which ones are towards. And it's likely at the moment that you're probably doing a combination of both of these things. And one of the key ways we support people is to notice those away moves, the things that are actually taking you away from what matters in response to the pain, and supporting you to think about other approaches or different ways to manage that might work better for you in the longer term. So our focus really is on the kind of additional problems that come along with managing persistent pain day to day, and all of those things that we talked about. And the approach is aimed at having a sense of how to have more control over the things that are important to you, and connecting back to those in some way, and more of a sense of getting back to yourself and what really matters to you. So it's not trying to get rid of the pain, but to make it almost less dominant in your life. So just to explain a bit more about how exactly we might do that, and it will be very individual for each person, but there are a range of different approaches that might be helpful. So we often support people first to do more of what matters. So working out for you, what is it that matters? Like that question at the very start of today, what matters to you in coming through our service? What would make that difference? And helping to work out ways to keep going towards those things in some way, despite the pain. And also setting achievable goals. How might you be able to work towards those things, and us supporting you to do that? We also look at activity, so noticing what you're doing and how to manage pacing your activity throughout the day or across a week to manage the pain and avoid those kind of patterns of over and under activity that are really common in people we see. We can also think about kind of stretches or adapted Tai Chi. And as I said before, it's working out a bit more about what doesn't work so well, taking a step back and noticing what's not helping me in this moment, or how could I do things, tweak things and make things slightly better to make more of those moves towards the things that matter. Thinking about ways to be more present, a bit like you were saying with family, and how to feel that you're able to be more present, have that quality time with people around you, or quality engagement in the things that you're doing despite the pain. Also thinking about managing thoughts or emotions differently. So we know that obviously pain can impact on feelings of anxiety. It can bring up impact on our mood or bring up a lot of feelings of frustration, which is really understandable and often something we support people with. So how can we manage those thoughts and emotions differently so that you can keep going towards the things that matter? So it's also finding ways to communicate better with those around you, building that understanding for yourself about pain to then support other people to understand what you need or what helps when you're experiencing a really difficult time with pain, or just to understand generally. We support with managing flare-ups, making sense of patterns that might be contributing to regular flare-ups, but also what helps you in times when you're having flare-ups with pain. Ways to be kinder to yourself in managing day to day with the pain. And also improving sleep is something that often people that come into our service are really struggling with the impact of pain on sleep. So we can support with ways to improve sleep as well. So we've come to the end of our session today. I hope that that's been a helpful kind of explanation of understanding the impact of pain, but also thinking about how we support you as a service to manage all of those things. As I said at the start, as we're recording today's session, we invite you to rewind or go back to bits that weren't clear, or and to take your time going through this recording as often as feels helpful. And you can also discuss any of the ideas from today in your next appointment with your health professional as well. And obviously a massive thank you to our participants today for agreeing to consent to record today so that you can watch this recording back. So yeah, thank you to all of you for sharing your experiences and ideas. That's really invaluable. So thank you for watching, and we hope you found it today helpful.